Okay, this is a 360 of my apartment. This is my patient. This is my videographer, my fish, my workstation. I'm gonna hand you off to my lovely videographer, and she is hopefully not gonna videotape her fingers. She's gonna tell me when to start.
Go.
Okay, I'm gonna start with hand hygiene. I am also going to clean my stethoscope with an alcohol wipe. So I'm gonna open that and get it clean so I can introduce myself to my patient. As well, I am going to put on gloves. So while I do this, I'm gonna get all ready. So, hi there, I'm Heather. I'm a student nurse with Seneca College, and I'm gonna be doing your evaluation today. Is that all right?
Fine.
Okay, so first off, are you comfortable? Do you have to use the facilities?
No, I'm fine. I'm comfortable and quite fine.
Okay, so next I'd like to start with your name.
My name is Dan McKenzie.
Okay, Dan, I just want to go ahead and confirm that with your hospital bracelet. Okay, great. And while I try to force this glove onto my hand, would you please tell me your date of birth?
July 27th, 1965.
Okay, great. And how old are you?
I'm 55.
Okay, great. So I know I asked earlier, but I just need to get your consent to give you an evaluation.
Yes.
Okay, patient has offered his consent, so I am going to go ahead and I'm going to provide privacy. Okay, so the first thing I'm going to do, Dan, is that I'd like to check your ears. So they are symmetrical, there is no drainage, and there is no buildup of cerumen. So that looks good. So the next thing I want to do is I want to palpate the auricle and the tragus. So I'm going to palpate. Do you feel any pain?
No.
Tenderness?
A little tenderness, no pain.
Okay, and for the tragus, same question?
Same again. A little tenderness, no pain.
Okay, so the patient doesn't feel any pain, just a little bit of tenderness. So I'm going to do something called a whisper test. I'm going to occlude your ear and I'm going to whisper 3 words. I'd like you to repeat them back to me, okay? Okay, so.
Dogs have owners. Cats have staff.
Okay, so the patient repeated everything word for word. Pardon, word for word. So there is no problem with the hearing is intact. We're going to move on to the rest. So I'm going to look at your nose and sinuses. So the nose is midline, it is symmetrical, there's no discharge, and there's no crusting of the nares. So I'm going to palpate the frontal sinuses as well as the maxillary sinuses. So palpating the frontal, do you have any pain?
No.
Tenderness?
A little pressure, but no pain.
Okay, and the maxillary.
Same again. A little pressure, no pain.
Okay, so patient feels a little bit of pressure, but no pain. So I want to move on to the mouth. So looking at your lips, they are pink. They appear hydrated, there's no lesions. I'm going to do a little bit of a further examination, so I'm going to have you open your mouth for me, okay? Okay. So the gums are a healthy pink color, there is no bleeding, there is no lesions, so no sign of infection. The teeth are even, they are all present, and they are not loose. I'm going to check the tongue next. The tongue is a healthy pink color. Lift the tongue up for me. Okay, so underneath the tongue there are no lesions and there is a presence of saliva, so the tongue is hydrated. The next thing I'd like to look at are the soft and hard palate. So I'm going to look at the back of your throat. Okay, so the soft and hard palate are intact. There are no lesions present. There are, however, a little bit of redness, so it's probably congruent with the sore throat that my patient came in with today. So the next thing I'd like to do is I'd like to check for the nerves, the cranial nerves 9 and 10. Those are the glossal pharyngeal and the vagus nerve respectively. So what I'm going to have you do is I'm going to have you give me a big ah. Okay, so the uvula moves up and back. So cranial nerves 9 and 10 are intact. So I can get rid of those now. So the next thing I want to check is for cranial nerve 12, which is the hypoglossal. So what I'm going to have you do is stick your tongue out for me. Okay, the tongue is midline. And can you wiggle it back and forth? Okay, that's great. And repeat after me. Light, bright, dynamite.
Light, bright, dynamite.
Okay, so the cranial nerve 12 is intact. So we're going to move down now to the throat. So looking at the throat, there are no masses, there's no edema, everything is symmetrical. I don't see any signs of swelling, so I'm just going to go ahead and palpate. I do feel a little bit of heat, so is there any pain here?
No.
No pain, okay. There is a little bit of warmth as I specified, but it doesn't appear that there are any masses and the thyroid does not appear to be enlarged. So the next thing I'd like to do is check the carotid. So this I'm going to do on the right and left sides. So the right side, there are 60 beats per minute, which is a regular rhythm, and it's got a 2+ grade, so which is strong. So I'm going to try the other side now. Again, 60 beats per minute, which is a healthy rhythm that's normal, and the grade is 2+, so it's strong, so they are equal bilaterally. This is a good sign. So the next thing I'd like to do is test for the cranial nerve 11, which is the spinal accessory. So I'm going to have Dan here do some movements with a little bit of pressure and resistance. So I'm going to put my hands up on both sides and move your head for me back and forth. Okay. I'm also going to provide some pressure here and lift up for me. Okay. All good. That's what I like to see. Okay, so cranial nerve 11 is intact. So what I would like for you to do is I'd like you to just lift up your sleeves here. I'd like to check your upper extremities. We're going to pretend that those are up. So, looking at the arms, there's no muscular atrophy. Everything is symmetrical. I see no edema, swelling, or masses. I'm going to palpate. Do you feel any pain?
No.
Okay, any tenderness?
No.
Temperature is regular. There's no edema, no masses, and there's no heat radiating off of the joints. So the next thing I want to check is the fingers. So if you could put your fingers over me. The nails are rounded. I'm going to do something called a capillary refill test. This is where I'm going to squeeze the fingers and see how long it takes the blood to return. Okay, so it's 2 seconds. That's a normal finding. That's what we want to see. So while I have your fingers out, we're going to do a couple of range of motion tests, okay? So follow along with me. Flexion, extension. Wrist, flexion, extension, radial deviation, ulnar deviation. Okay, so we're going to move on to the arms. So we're going to do flexion, extension, supination, and pronation. Next, we're going to do a little more movements. If you can get up for me, please. We're going to go abduction, adduction. And we're going to rotate internally. And we're also going to externally rotate. So up behind here. Okay. And lastly, I just want to see you shrug your shoulders. Okay, that's great. You can sit back down. Now, I did notice that there was a little bit of trouble with movement. Did you feel some pain?
A little stiffness, yeah.
Okay. Well, what we're going to do is we're going to look a little more. So I'm going to have you lift up the back of your shirt for me. And I'm going to do some checks here, okay? So this is the posterior thorax. There's no scars evident. There is no edema. Everything is midline and symmetrical. Now I'm going to just palpate a little bit. Do you feel any pain?
No.
Any tenderness?
No.
Patient feels no pain or tenderness. Okay, and I don't feel any edema, no sign of masses. So I want to see if you have a symmetrical respiration. So what I'm going to do is I'm going to hold my hands like so. I'm going to have you breathe in and out. And again. Okay, so my thumbs move apart when Dan inhales, which is symmetrical respiration, which is what we're looking for. The last thing I want to do is I want to check for lung sounds. So what I'm going to do is I'm going to auscultate. There are 9 places that I will auscultate. And I'm going to move back and forth so I get both lungs. 1, 2, 2, 3, 4, 5, 6, 7, 8, and 9. Okay, so I noticed a little bit of crackling and wheezing, which would say to me that the lungs are not clear. So I'm going to move around to the anterior of the thorax, and here there are going to be 5 places that I'm going to listen for lung sounds. So again, I'm going to auscultate. If you could lift your shirt for me. Okay, and again, I want to check both lungs. So 1, 2, 3, 4, and 5. Okay, so there are 12 breaths per minute. So the rhythm is natural. It's what we're looking for, but there is a little bit of raggedness to the breathing. So again, I would suggest that you see our physician next. I only have one more test that I need to do, and that's the anterior-posterior transverse ratio. So I'm just going to put one hand here. Okay, so that's a 1 for the anterior-posterior. Transverse is 2. So it's a 1:2 ratio, anterior posterior transverse. Thank you very much, Dan. Thank you.